morning, everyone. This is Mike Hill with Total Control Health Plans and Coldbrook Insurance, and I'm glad you could join us this morning for our webinar focusing on Lakeshore employers and sharing two strategies with you that we think you may find valuable as you think about any potential changes to your health plan in coming months. What we're going to talk about today is two things. I'm joined by Valerie Cramer with HealthBridge, and she's going to be the second part of our webinar this morning. And I'm going to be talking about first a direct-to-employer contracting option with Holland Hospital that we think you'll find a lot of value in. So I'm going to talk very quickly. Our goal is to wrap this thing up in 30 minutes. We value your time very much and want to let you get back to your day. Both of the concepts that we're going to talk to you about today, I think might be very appealing to you, and you may want to use one or both of them. And so if this is something that you find interest in and you want to know more, then we'd love to connect either with me or Valerie independently, where we can talk about your particular situation independently and one-on-one. So let's jump right in and talk about D2E with Holland Hospital. So first thing I just want to share with you, if you haven't heard D2E yet, you certainly will in the not too distant future. It's kind of like RBP or reference-based pricing. It's one of the new flavors of the week in healthcare. We love to abbreviate things, and D2E stands direct to employer. And in this case, it's direct to employer with Holland Hospital. So why is something like a direct to employer or relationship important for an employer sponsored health plan? Just to take a step back, want to just help you understand our philosophy at Total Control Health Plans and what it is we're trying to accomplish. On the right-hand side of the screen, you're going to see our illustration of what a traditional health plan looks like, whether being fully insured or self-funded if you're using a carrier model. You, the employer, and your members are down at the bottom, and then you're separated from your healthcare supply chain by this immovable brick wall, which happens to be a commercial carrier. As hard as you try, you can't get over or under or around it, and you have no idea what's going on with your healthcare supply chain in the background. So what we want to do is help you build a plan that looks like this on the right-hand side. We want to help you build the plan that's best for you and put a transparent administrator around you, and then plug in the various concepts that make the most sense for you and your employees to get the best plan for you. What you'll notice at the top is direct access. And what we mean by that is, how do we access healthcare providers while cutting out the middlemen and getting full transparency both for the plan and the members? And that's what we're trying to accomplish with a direct to employer contract, in this case with Holland Hospital. The reason this is important is if we talk about what our objective is with Total Control Health Plans, it's number one, to help members get better quality care. Number two, we want to reduce costs for both the plan and the member as much as we possibly can. And for us to do that, we need to focus on the 80 to 85% of plan costs, which is represented by claims. And practically speaking, there's two ways you can address healthcare claims. You can either prevent them from happening, or when you do have them, you can pay as little as possible. And that's what we want to talk about today with this direct to employer opportunity, is that we want to pay as little as possible for the highest quality claims that we can whenever they occur. So I want to give you a specific example. If we take a look at on the left-hand side of this slide, I'm taking you through a CPT code 74176, which is a type of radiology claim. And this is specific information from a client of ours that's using a PPO network to access Holland Hospital. The plans that we build, the first thing that we really put in place is having a high quality medical manager. So if we take a look on the fingers crossed model or approach you could take, the member works with a high quality medical manager, and the member seeks prior authorization for care. They say, hey, I need to have XYZ done, and I'm planning to go to this particular facility, in this case, Holland Hospital. The medical management firm can then use a number of different tools available to them to identify, is this a high quality location or not? And in this case with Holland Hospital, they'd identify, yes, it's a high quality location. But the next question that comes up then is, how much is this going to cost? No one has any idea. The TPA doesn't know, the medical manager doesn't know, the member doesn't know, probably Holland Hospital really doesn't know either. And in this particular case, for CPT code 74176, within the last 6 months at Holland Hospital, the hospital billed $2,934 for this claim. Then, using the PPO network we're using in this particular case, the discount, which is unknown to us, was applied, and somehow the plan ended up paying $487.33. Pretty significant discount, but no one had any idea what that number was going to be ahead of time, nor did they have any idea if it's competitive or not. On the right-hand side, if we use the direct-to-employer contracting option that we have, and I want to point out this is an exclusive arrangement that we've negotiated with Holland Hospital for our customers to take advantage of. the member would still go through the same process of using their prior authorization, calling the medical management, get prior authorization. The medical managers would again look at quality first. Is this a high quality provider that the member wants to go to? And then they're also going to note that, yes, this member is also part of the direct to employer contract we have, in this case with Holland Hospital. They can then pull up the fee schedule that we have in place that's transparent to the plan. We have access to it. The employers have access to it. Look up CPT code 74176 and find out it's going to be $460. Can notify the member before they go exactly what it's going to cost. And you'll notice it's also more cost effective than the PPO discount was accomplishing. Ultimately, that's all we're trying to do. This is not a complicated thing. We just want to completely understand what it is we're going to pay ahead of time, make sure we're paying a fair price. We can compare that to some alternatives and make sure our plan runs efficiently as possible. A couple other pieces I just want to draw your attention to. Direct to employer contracting, as I mentioned, is kind of the flavor of the week. And if you haven't heard of it, you will soon. Especially with COVID, this has kind of expedited the process that more and more healthcare providers are looking for ways that they can engage employers and drive business their way. First thing that we look at when we consider a direct to employer contract is quality. And this chart that we're looking at is very busy, but it's looking at 129 hospitals in Michigan and ranking them on a number of things, but first and foremost on quality, with the highest quality hospitals on the left-hand side. And as we progress right, the quality goes down. I just want to point out in this particular case that based upon Medicare data, Holland Hospital is the 5th highest quality hospital in the state of Michigan. So certainly a very viable option and viable candidate to consider establishing a direct to employer relationship with. Not every hospital is good at everything though. And one of the key things I want to point out to you is that when we're steering people to high quality providers, that's the first thing we look at is quality. We're not looking at price. And even though we know that we're going to get a good deal on a particular service with Holland Hospital, if they're not the highest quality option or at least equal to the others in the area, we're not going to steer somebody that way. In this particular case, we're looking at DRG 470, which is a major hip or knee replacement. And Holland Hospital progresses from 5th highest quality in the state to this particular category is 4th highest quality. But there's a couple things that I want to draw your attention to as well. First and foremost, the data that we're looking at here on the chart on the left-hand side, this is looking at a number of key pieces of information that hospitals have to submit to Medicare. Their cost average for this DRG 470, major knee and hip replacement, is $14,566. On average, Medicare pays them less than their actual cost. And it's not something that is probably mystery to anybody, but oftentimes hospitals lose money on many Medicare claims, and Holland does in this particular case. But the next thing I want to draw your attention to is the billed average. What Holland Hospital bills on average for DRG 470 is $42,000, almost $43,000. Then whatever PPO or HMO network you use applies some discount, and at the end of the day, a number comes out and you have no idea what it is. In this particular case, when we look at our direct to employer contract, DRG 470, the price is $23,790, which is 1.6 times what Medicare is, which is a fair and reasonable ratio. And it allows Holland Hospital the opportunity to make some money, make a profit, but also we know it's very competitively priced, and we know that before the service has been rendered. What having an arrangement like this allows us to do is then build plans that we believe give members higher quality care and better coverage. And that's the name of the game. This is an example of a plan we implemented for a client where we took their traditional plan, which was an HSA with an in-network and out-of-network benefit, and a traditional plan with an in-network and out-of-network. And we added the third column, which we call the guided network. And what we're able to do by using tools like this, direct to employer contracting, full transparency, is that if a member goes where they're steered to go based upon quality number one and then cost, in this particular case, the plan pays it at 100%. No deductible, no co-insurance on the traditional plan. And on the HSA plan, we have the lowest possible HSA deductible possible. And then the traditional network, if I want to go wherever I want to go, see whoever I want to see, I've got my traditional plan. By using tools like this, we're able to give members better coverage, keep the cost of the plan in check, and achieve full transparency, which is the name of the game. Just to kind of drive home the point that the total control health plan concept works, this is very fresh in our minds. We just delivered a year-end report to a customer of ours. Leading into their 6/1/19 renewal, they got a 0% increase from Priority Health, which typically would be considered a, hey, that's a win, let's just lock it in and move forward. But this employer wanted to push the envelope and knew they could do better. And so with our help, they built their own total control health plan. And at year end, at the end of May 31st, 2020, we were able to get their performance for the full 12 months. This plan was $1.4 million less expensive than had they renewed with the 0% increase with Priority Health. Their per employee per year cost went from $9,200, almost $9,300 per employee per year to $6,300, almost $6,400. A substantial savings by taking the plan apart and building the plan that's best for them. Finally, I want to point out to you, for those of you that are on the call with us today, that migrating to a total control health plan is a continuum. Some of you are fully insured, some of you are self-funded with a carrier model, and there's a lot of stops that you can take along the way. Using a direct-to-employer contract, you generally need to be with an independent third-party administrator that's going to let you do this type of thing. It's hard to do this in a fully insured environment with a carrier or self-funded with a carrier. But you may not be ready to do that yet. You might be ready to take advantage of some other opportunities, though, to make your plan more affordable, more accessible for members so they're getting the care that they need. And so what I want to do now is I want to turn it over to Valerie Cramer. What she's going to talk about is HealthBridge, a new homegrown West Michigan-based company that can be layered onto a self-funded plan or a fully insured plan to help employees deal with the costs associated with using their plan. And it's something that can be used in conjunction with a direct-to-employer relationship, or it can be used independently. So I'd like to introduce Valerie, who's going to take over now and share a few slides with you and introduce HealthBridge. And the last thing I'm going to mention is I'll be monitoring the Q&A section of this tool. So if you have any questions, let us know, and I'll pass them on to Valerie. And our goal, again, is to get this wrapped up by noon. Valerie, the floor is yours.
Thank you so much. Thank you so much. I really appreciate it. Can you hear me okay?
We can.
All right. Well, thank you to Total Control Health Plans and you specifically, Michael, for inviting us to participate in this. I love the fact that with Total Control Health Plans, you do offer that continuum for folks to be able to find a spot on that continuum and keep building a plan that works for them over time. So I'm excited today to talk to you a little bit about the HealthBridge. We're a unique homegrown right here in West Michigan employee benefit, and we really are reinventing financial well-being in the workplace. Navigating the cost of medical bills can put a physical and emotional strain on your employees, so we're here to help. Going to talk about two things today, just give you a brief overview and then a little bit about how we work. Again, I am going to keep this very brief because we do want to be mindful of your time, but if you're interested and want more information, which we hope you do, you can reach out to either Michael or me. So a little bit about HealthBridge. So our founders saw a very growing problem that needed a solution. Health plan designs were turning what was once a benefit into a liability, and employees really are becoming functionally uninsured. And so when you have an average family out-of-pocket maximum of upwards of $8,000, with a majority of Americans living paycheck to paycheck, and then nearly half not being able to come up with $400 in times of an emergency, it's no wonder that 64% of employees have reported that they've skipped or delayed necessary medical care due to the high cost of the out-of-pocket expenses. So we're seeing the majority avoid their doctor strictly out of financial fear. And you know, these statistics are actually pre-COVID statistics. So our founders knew that something needed to be done. So the goal was to provide a benefit where all boats rise, that it would benefit all stakeholders and not at the expense of any one of them. So we're a first of its kind employee benefit. We help employees and their dependents, regardless of their financial status, manage and pay for their out-of-pocket medical expenses on terms that promote the right care at the right time, that necessary medical care. When a member has a claim, we cover all the medical expenses on behalf of our members, and then we work with our members. We give them a consolidated monthly statement, which is a first in the industry, and they have access to consumer-friendly repayment terms. And then again, that's regardless of what their financial status is. This gives our members confidence that their health plan not only protects their health, but it also protects their finances as well. And so HealthBridge was designed to benefit, again, everyone in the healthcare ecosystem, the patient, the employer, the provider, the payer. We really provide this radical solution that doesn't require radical change either from your carrier or from an employer group. So financial security, finally, I love that. So we've introduced this brand new category of employee benefits. It's an ERISA employee benefit that complements your health plans. So you might have an HSA, HMO, PPO, you may be fully insured, self-funded. We can work with all those types of plans. And we do cover all medical, in-network, out-of-pocket expenses. So medical only, not dental, vision, pharmacy, strictly medical. We help employees and their dependents manage balances due after insurance with a single statement. I'm going to show you an example in a minute, and also with those friendly repayment terms. And there are no application forms, no enrollment forms. It's guaranteed issue to everyone that's enrolled in your health plan today. So we don't take the place of your health plan, we really complement your health plan today. And what does this mean for you? Well, you know, protecting your employees and their family members, providing that financial peace of mind, again, regardless of their credit worthiness, being able to reduce care avoidance. Employees then get the care that they need when they need it. And that, of course, increases health outcomes very positively, and it lowers healthcare costs as well. It improves the value and confidence of the employer-sponsored benefits. So use it as an employee retention and recruitment tool. You work so hard with your agent to create these health plans, and they cost a lot of money. So this will help improve the value to the employee as well. And then obviously we know that when we have a workforce that has well-being, we're reducing absenteeism and we're increasing presenteeism. And then we create that exceptional member experience with that consolidated monthly bill, consumer-friendly repayment terms. We're keeping the providers focused on care versus collections. And we really believe that preserves the employee dignity and that patient-provider relationship. It encourages employees and their family members to go and complete their follow-up care as well. That's one thing we're noting as we've been implementing HealthBridge, is that sometimes people will go in for the initial care, but they don't follow it up because they know they have a balance due, and they know they're going to get asked that when they're at the registration desk. So this takes all of that away and removes it. So how do we work? I'm going to give you a little peek into the day in life of a HealthBridge member. The first thing, you know, the member receives medical care from a HealthBridge network provider, and we'll talk about who that is. But no longer do they have to make a decision or even think about, can I afford to actually go in and have this MRI that my physician is asking me to have, or do I need to wait and get it down the road? I can do it because I know that I've got HealthBridge bridging that gap for me. No financial barrier against getting that care. At the time of service, the member is going to present their HealthBridge card, and again, they're not going to pay that provider for any coinsurance, copayments, or deductibles. HealthBridge receives an eligibility and patient liability report from the carrier or the third-party administrator on a weekly basis. So there's nothing that the employer needs to do to facilitate this process other than in the beginning and the implementation, we have a data sharing agreement. It's a one-time agreement, and that is it. We get all the information we need from the carrier or third-party administrator. That allows us to pay the providers up front and on behalf of our members for their portion of those covered medical claims. Step 4, HealthBridge then, we work with our members. They receive a single consolidated statement. When you think about the reasons why people have a hard time paying for their health care, 1, they don't have access to credit, so we're helping with that. And 2, they don't understand their invoices and their bills that they're getting. They come at all different times during the month, multiple bills. I know I had several events in one year, and I really could have gone to collections for a $6.50 bill just from the thought of, my gosh, I got hundreds of bills, trying to match them up to my EOB. You know, it can be very, very confusing out there. So we simplify it and put all of the services that were provided in the last 30 days on one single consolidated statement when our members see a HealthBridge provider. It's very easy to read, and I'll show it to you in just a moment. And then we work with our members to repay. So our members have consumer-friendly repayment terms with no recourse back to the provider or to the employer. HealthBridge purchases that debt, and we work with the members on repayment. It's a very soft approach that we take. We don't send anyone to collections. We offer everyone the ability to repay over 24 months with a 3-month interest-free period, and then a very low fixed annual interest rate. I don't know about you, but I don't have any cards in my wallet at a 7% interest rate. And then we offer all of our members a 10% discount on balances paid in full at any time. That's our way of saying thank you to our members. So whether they take advantage of that 90 days without any interest and they pay us on that 90th day, they get the largest 10% discount, the biggest bang for their buck, or whether they start paying it off and 6 months later they come into some money and they decide they want to pay the balance off, they'll get that 10% at that time as well. Again, that's our thank you for our members. And then we provide a really easy way for folks to work with us to manage their accounts. It's portal, a mobile website, paper, or over the phone. We don't have any fees for our members, no late fees, no fees for paying over the phones. It's all very, very easy to manage. So here is an example. I know that's kind of a small print there, but I want to let you know so that you notice this. We co-brand our statements. This is an employer benefit that you're offering, and it boosts the value of your employee benefit package that you offer. We also, for the first time ever, are able to consolidate these charges with multiple providers, so not within just one health system, so you see multiple claims. And we offer we add the claim ID so that for the first time ever, you can take this invoice or this monthly statement and match it to your explanation of benefits from the carrier. Easy repayment options, including that 10% discount, paying in full, or longer term arrangements as well. We have a member portal as well that gives the same simplicity to our members when they're making their payments online. And we offer one single place for the family to manage the entire family's out-of-pocket medical expenses. We know typically one person in the family manages the bills, and so here's one place for them to do that on this portal. And then we do accept payment via MasterCard, Visa, HSA, FSA, or checking account. Seamless across all our devices. So whether you use mobile, paper, or your online portal, it's all seamless to our members. So we talked a little bit about step 1 in the day in the life is having the members see a HealthBridge provider network. You can see there on the left-hand of the slide, we've got over 2,500 providers in West Michigan. Now, I know many of you are located on the Lakeshore in the Holland area, and I do want to let you know we've had some great discussions underway with Holland Hospital. And as Michael and I were talking, it's a little bit of the chicken or the egg. the hospital would like to see that there are employer groups that are interested in offering this benefit. And so anything that you can do, if you're interested, please again, reach out to either Michael or me, and we're happy to have additional conversations there. But you can see we have a full network of providers in the Grand Haven and Muskegon markets. We've really made great strides in the Grand Rapids market as well. We have many employer groups that look at this and say, even if I'm only positively impacting 30% of my employees, I'm offering a benefit. It's free to employers for 18 months. And so there's no money out of your pocket to help your employees and their families. We do have discussions underway really every direction in the state, and we also are going to be working with a health system out on the West Coast later in the year. So we're expanding. We've got a provider directory. I'm happy to provide that to you. So just again, want to make sure that we highlight it complements your health plan. We don't take the place of your health plan. We manage those out-of-pocket medical expenses for all your employees and their family members that are enrolled on your health plan today, providing that financial well-being, access to financial relief program if they need it or not. And if they don't, they can take advantage of the 10% discount and a single consolidated, easy to read monthly statement. And again, it's automatic, guaranteed issued. There's nothing the employer has to do outside of work together to communicate the benefit. We do on-cycle or mid-year offerings, and we can do everything virtual to get your company and the employees educated about this new benefit. So again, contact Michael or me. We're happy to explain the program in more detail and review really how easy it is to roll it out to your employees anytime throughout the year. So thank you so much. Here's my contact information if you need it. Jot it down, and I'll be really excited to talk with you. Thank you, Michael.
Hey, thank you, Valerie. And so one question, just to bring this full circle, we have about a minute or two left, and we certainly want to end on time, but there's a ton of flexibility in how an employer would integrate HealthBridge into their plan. So for example, a large employer in Grand Rapids, January 1st, a couple thousand employees left Priority Health, went to an independent third-party administrator, established a direct-to-employer relationship with the Trinity hospitals, so Mercy and St. Mary's, Muskegon, Grand Rapids, and throughout the Trinity network. And they have now a 3-tier benefit, where if I see a Trinity health plan or health provider, I get a better benefit, and I can use HealthBridge. And then if I want to see anybody else, I can continue to do that, correct?
That's correct. Yep, we can create those narrow networks. I love your verbiage, guiding them to a narrow network where it can be lower cost, or even on a benefit design. They may have a traditional benefit alongside of an HSA, and they'd like to get a few more enrollees in that HSA. We could put the HealthBridge benefit just on that HSA plan. So lots of flexibility there. Yeah.
Awesome. Well, just want to say a big thank you on behalf of Valerie and myself. We appreciate you all joining us today, and certainly we'll follow up with a recording of the webinar, but also any additional information that you may request. And I'm happy to connect you directly with Valerie if needed. And we appreciate your time and look forward to you joining us again in a future webinar.
Thank you. Have a great day, everyone.